Good afternoon, everyone, and welcome to today's Black Health Trust. And with no further ado, I will turn the program over to our founder, Dr. Randall Maxey.
Thank you, Dr. Ivan Walks, Dr. Barbara David Stevens, Dr. Hines, and Dr. Lawson for joining me for our weekly session. Good afternoon, everyone. We have a very interesting topic today. We know that there's a lot going on, and there's a lot of things that would confuse you about our survival in this country of ours, and also all the hullabaloo about DI and membership, etc. But I want to keep us focused on things that we can have control of. So I had some articles that I noticed this week concerning the increasing rate of stroke that happen in the black community. And we know that strokes usually happen in old folks like some of your co-moderators and me. But but the real increase is on younger people and middle-aged people in their 30s and 40s and 50s. So we're going to go through some of that. And Simon, if you put up the first slide, if my co-moderators would assist me as we go through. But I guarantee you my site is getting better every day.
All right.
First slide, Simon, if you would. So we want to talk about stroke in the black community. Go to the next slide. So there's a disparity in real, and it starts very early. We know that it can be nearly 2 times more likely in the first stroke happens in black adults more than white adults. 4.3% of black adults report a previous stroke. That's in 2020 and 2022. We know that there's a 7.8% increase in U.S. stroke prevalence since 2011 and 2013. This is not just an older person's disease. It also happens in young people. Next slide, Dr. Walt.
Stroke deaths have risen in midlife. Among U.S. adults ages 45 to 64, there's the number of stroke deaths per 100,000 in 2012 was 20.2. 2019, it had risen to 21.7. And by 2021, it had risen again to 24.4 per 100,000. Black men and women had the highest middle age stroke death rates in every U.S. region studied. The burden was especially high in the South and the West.
So comment a little bit on what this slide, Dr. Walks.
I'm sorry?
Comment a little bit more on this slide. Your thoughts.
Uh,
And like
my
everybody else
thoughts,
chime
my,
in too.
my thoughts about this slide, Dr. Maxey, is that um, a lot of people, including myself, think about stroke as something happens to older people. So when I look at this, I'm seeing that from 2012 to 2021, there's a significant increase in strokes. Who even knew they had them in ages 45 to 64? So this is a big deal, and the fact that Black men and women have the highest middle age stroke death rate is is pretty significant. And I guess the last thing I'll say is that we're talking about deaths. We're not talking about just folks having a stroke and being okay. We're talking about people dying from strokes in midlife.
For our young doctor, Dr. Hines, any thoughts on this?
Um, it is to Dr. Walks's point. Um, it's a striking statistic. In my time in the emergency room, I've seen some middle-aged folks who had strokes, but oftentimes they were not in good health in general. So I didn't realize that it was a phenomenon outside of that kind of cohort. So it's interesting.
Dr. Lawson, any thoughts?
Well, virtually all the patients I've seen are young people who are completely healthy. well, not completely healthy, but then part of the reason is that I work in settings that provide substance abuse and mental health treatment. And I think you'll probably get into that later. Many of them were people who were using cocaine and other stimulants.
All right, thank you. Take next slide if you would, Dr. Lawson. I mean, Dr. Hines.
A stroke is a brain attack. So there's a few different types. So an ischemic stroke is when there is a blood clot that is blocking the oxygen from reaching a certain section of the brain. Then there is a hemorrhagic stroke, and that is when a blood vessel ruptures or bursts and bleeding injures the brain. And then a TIA is kind of like a warning sign for a stroke. And that's when you have stroke symptoms, but they disappear within 24 hours. It is still urgent and evaluation is absolutely required. And every type that's on this slide is an emergency.
Anybody else want to comment on this one?
I'll also just add, like, people have this, there's this thing that people say where it's a mini stroke, right? And sometimes people will say that they had a TIA because their symptoms went away over a few days and it was a mini stroke. TIA by definition, if it hasn't gone away in 24 hours, that is a stroke. And praise God or be grateful that symptoms went away, but some people are falsely reassured about what happened to them because the symptoms went away.
Yeah, I like that term. A stroke is a brain attack. What did you do that your brain attacked to?
I just want to note that, and again, people who have stroke don't just show up in primary care, the emergency room. They also show up surprisingly in mental health clinics, in senior facilities. And I have found a number of folks who had what was later found to be TIAs, and who later then went on to have real strokes, and who were sometimes misdiagnosed as having a psychiatric disorder or a neurological disorder. Strokes that occur close to or involve the limbic system often will produce psychiatric symptoms.
Okay. Next slide, Dr. Lawson.
High blood pressure is the biggest preventable cause. 60% of Black adults have high blood pressure. Hypertension has no warning symptoms. I just want to emphasize that. Because I have patients coming in and say, I got hypertension because I got a headache, or I don't have hypertension because I feel fine. Hypertension often has no warning symptoms. Damages small brain arteries, promotes clots and bleeding, often begins earlier in their life, also damages the heart and kidneys. Know your numbers, treat consistently. And I want to just go back to know your numbers business because, you can get a blood pressure kit off of Amazon, but a number of people take it and get cobwebs on it and just don't ever check their numbers except the occasional time that they may end up in the emergency room or or go by their primary clinic office.
So let me just add, Dr. Lawson, that yes, you can get a blood pressure cuff kit off Amazon or Walgreens or Walmart, but you have to use it properly,
Yes.
or else you don't
That's
get
right.
the right numbers. They're not accurate. If you're not putting the cuff on in the right place or the right way, or it's not the right size, or you don't hold your hand the right way for some of them. So, like everything else, read the directions.
I think that's very important. Dr. Hines, you want to talk about the directions for using blood pressure cuff?
Well, actually, sure. I will talk about the proper use of blood pressure cuff, and then I want to go back to treat consistently. So a blood pressure cuff, you are supposed to be seated 2 feet flat on the ground. Be still, not moving. And If you have a wrist cuff, then it's on your wrist. If you have an upper arm cuff, then it's on your arm, right? There's usually lines and markers that let you know where things are supposed to line up. It'll also let you know if the cuff you have is too small based on where those lines line up. Most people were talking about a digital cuff. After you've sat down, got situated, and be still, then you press the button, right? And then you sit there and be still and breathe, right? Because some people, for whatever reason, want to hold their breath, right? And breathe while the machine does its thing. If you are wiggling around, if you are fussing at people while you're sitting there trying to be still and take your blood pressure, take your blood pressure reading or talk on the phone or whatever, all of those things will impact the reading.
And no cross legs.
Right, exactly. And no cross legs, that's a very common one. But I wanted to just speak to treat consistently, because that one there, so taking medicines consistently and without fail is hard, right? It can be, especially the more pills you get on board, and then sometimes, remembering to get those refills and that type of thing. Naturally, for people who have high blood pressure, your blood pressure more than likely gradually rose over time. But what happens when you stop and start medicine, take your medicine consistently and then miss a few days, it turns your blood pressure into like a roller coaster ride. And that up and down is what can put you at increased risk for the strokes that we're talking about. So the treat consistently part is really important.
And what I want to add to this is a lot of people think that they come in, their blood pressure is normal, they want to stop their medicine. And my contention is many of them is normal because they've been taking their medicine. You don't stop your medicine unless your provider advises you to stop taking it. And usually it takes, there's literature out that shows that usually takes between 2 and 4 different medications to adequately treat your blood pressure. Fortunately, some of the pharmaceutical companies make combination medication. So you don't have to take 3 or 4 pills. You can get them all in one. And so it's very important to do it. And the medicines we have now don't necessarily cut your sexual function or ability to function. And so make sure you're getting the best medicine. Discuss that with your provider.
I have a question with Dr. Hines. What are your thoughts about these tests that use the fingers and or the smartphone test?
So what I tell my patients to do is when they have those, right, you should get them validated. And by validated, I will say bring whatever you're using to the doctor's office where we have a manual cuff, right, or a validated machine, and let's see if we get the same numbers. If we're getting the same numbers, then okay, carry on. I don't think that we can historically. Some of these more distal ones, the ones on your fingertips and that kind of thing, they're impacted by fingernail polish and sometimes pigmentation. But as technology advances, a lot of those things are going to get better. So I don't want to stay stuck in that stuff is no good, but just get it validated. The same thing with wrist cuffs. Wrist cuffs used to be not very reliable. They've come a long way, right? You do just want to make sure that there are, sites where you can look at what are more reputable machines, but if you don't have that, then just take it to your doctor's office. Y'all do it together, and you all should be getting similar things.
Also, Dr. Hines, there's some of us who have so-called big bones, and you have to make sure you have a blood pressure cuff that is the right size. If you have big bones, you want to make sure you have a big blood pressure cuff. So the cuff that's too small will not give you the right reading.
Well, the 100% true, right? And to go back to what we were talking about, part of the reason why the further away you get from, those bigger blood vessels, like the bigger arteries in your upper part of your arm, as the slide before was talking about things that affect small blood vessels. So the further you get down in extremity, the smaller those blood vessels. And sometimes if there is, going to be any hardening, clogging of the arteries, those smaller blood vessels are going to be impacted sooner than those big ones. So that it can impact your numbers. But to Dr. Maxey's point, blood pressure cuffs come in a variety of sizes. It is extremely important that you get the right size. A too big cuff is also a problem. So you can't use the thigh cuff on your little arm if you have a teeny little arm, right? And vice versa. If the cuff is too small, it also is going to give you falsely elevated numbers. So size matters.
I use the term big bone so I didn't offend Dr. Walks about body shaming.
Do not mess with my body image, Dr. Maxey.
Okay, but this first point on here, damaged small brain artery. There are a lot of people who don't know they have high blood pressure, but when they end up getting an MRI of their brain, they have what's called a whiteout, these white blood vessels between the two halves of the brain. And that's shows up as damage to the small brain arteries, and that can affect your brain and everything that the brain does. So that's why it's the silent killer. It may not be visible until you have the right studies, but these little vessels are very easy to mess up. Let's go to the next slide. Who's next up? Dr. Walks?
Sure. Stroke awareness. Stroke risk builds from several directions. Body and health. You have your high blood pressure, diabetes, high, low density lipoprotein cholesterol, obesity, chronic kidney disease, and sleep apnea. Then, from your heart and your blood, you can have atrial fibrillation, carotid artery disease, sickle cell disease, or abnormal clotting issues. Stroke can build from daily exposures, smoking. Dr. Lawson mentioned earlier, cocaine or methamphetamine use, heavy alcohol use, inactivity, and a high sodium diet. And then stroke risk can also build from your living conditions because you can't afford your medications. Medication costs can be an issue. Food insecurity can be an issue. Chronic stress can be an issue. Pollution or delaying care. All of that can be problem causing for stroke risk. Race itself is not the cause. Unequal exposure and unequal care matter. And let me mention, I was talking with someone this afternoon who, because of loss of a job, lost health insurance and was trying to pay out of pocket for medications. Medications can be really, really expensive, to the tune of several $100s or even more a month just for one medicine. So everything is connected. It's not that I won't take my medicine. It's that maybe I could afford it last month, but now I don't have the same insurance coverage and I can't afford it. So there are options and opportunities for folks to sign up to get their medicines covered differently if you lose whatever your primary coverage is.
Dr. Maxey?
Yes, go ahead.
Just want to note, the part about race itself is not the cause. And I don't know, you may want to say something about it later. Dr. Williams has often noted this. The up until recently, the rate of hypertension in West Africa was much lower than the ancestors, than their American counterparts. I also want to know, and I'm sure it doesn't mention it here, there's now well-documented evidence that especially these hyper-caffeinated drinks have been associated with stroke.
Excellent. Okay, let's take the next slide, Dr. Hines.
A stroke in a younger person needs careful research. So very high or untreated blood pressure is a risk factor. As we discussed, cocaine, methamphetamine, and stimulant exposure. A tear in the neck artery after a trauma. Heart rhythm problems or a heart defect. Pregnancy, preeclampsia, or postpartum complications. Sickle cell disease, autoimmune diseases, or any other thing that can be causing unusual clotting. I think we talked about the first two pretty much already, about blood pressure and the cocaine and the stimulant use. But a tear in a neck artery after trauma, that one is sometimes one of those things you look for when because remember, when you wear your seatbelt, right? And you're in a potentially, significant car accident, that upper part of the seatbelt is not that far from your neck. So that is the kind of thing that can cause those types of events to occur. You've got your carotid artery running right on both sides of your neck. So that is something that is often screened for in those kind of shock trauma settings for those major car accidents. And then the heart rhythms and heart problems and heart defects. So if you have any small holes in the heart, if you have any things that are giving you an abnormal heart rhythm, if your heart doesn't beat consistently, any pauses can lead to clots, and then those clots get pumped out to the rest of your body and your brain. And then pregnancy, preeclampsia, postpartum complications. Pregnancy is a state that makes you more likely to have blood clots in general. And then, going on to have a stroke is just one of the places that clots can show up in a pregnancy or peripartum state. And then I think, so sickle cell autoimmune disease and other clotting disorders, again, same fundamental issue, things that increase the likelihood of you having clots.
So can you talk a little bit about what preeclampsia is, how that affects?
So preeclampsia is usually an issue that occurs with pregnant women, usually in the later trimesters. They don't really know why it happens, but it can happen up to 6 weeks postpartum as well. And it causes high blood pressure, spilling of protein, and then it is usually treated either by delivery or a magnesium treatment that kind of relaxes the blood vessels. And then, as I said before, if it goes on to become eclampsia, which is a more severe version of preeclampsia, it comes along with a platelet disruption, liver function disruption, and then you can have all kinds of issues with clotting and not clotting appropriately.
And Dr. Lawson, can you speak on postpartum psychiatric conditions? Can they affect your stroke risk or high blood pressure?
Yes, it can. It's been in the news lately, and it's this whole question about chicken and egg. Is the postpartum complications result of any of these problems, or is the problem itself leading to some of these complications? What is very common, of course, is postpartum depression, but what is very uncommon, but is a psychiatric emergency, is postpartum psychosis. So the folks with postpartum psychosis end up in the news because they end up where mothers kill their children and so forth, or threaten to kill their children. But it's a very, very, very rare complication. Again, the big problem is that many women develop mood changes and depression during and after pregnancy. And it generates a lot of interest because there's a belief in our society that the mother is going to love the child and the mother will be enthusiastic about pregnancy. And that is not always the case, especially for women in low income and for folks in stressful home environments and a lot of Black folks in just facing systematic racism.
And on that last point, where it says sickle cell disease and autoimmune disease, we know that roughly 12% of the African American population in America has a problem with an inherited kidney dysfunction that's triggered by things like sickle cell, autoimmune disease, and unusual clotting that can happen. That's another subject, but we should know that, especially in those people, we should have them investigated and tested appropriately. Next slide, Dr.
Okay, I'll take this next slide, Dr. Maxey, but let me comment. Dr. Hines mentioned earlier about neck trauma and about the seatbelt. I don't know that everybody pays attention to the fact that in most cars you can adjust the height of that part of your seatbelt that goes over the shoulder and goes next to your neck. And so learning how to adjust that so it's not right rubbing and preparing to hit your neck, even if you turn a corner too fast, is something that's worth mentioning. Worth mentioning that seatbelt is there to protect you and keep your body from flying forward into the car. but your neck should not be the place where all the force goes. So just be aware that you can, in most cars, make that adjustment.
I got another.
Okay.
This is a question on my point. What about people who do Greco-Roman wrestling and the chokeholds and those things? Are they a factor in neck trauma, carotid trauma?
So
Uh,
any of those things, any of those activities, can both cause scarring in the carotids, which can then also lead to issues too, not just tears, right? So anything that is causing repeated trauma to that carotid area has the potential for negative consequences. So yes, there are risks associated with that type of athletics.
So
Yeah,
also,
let me just know that we actually did a study on that and found that it's actually fairly uncommon. And the reason it's uncommon is because a chokehold provided properly is not a chokehold. Chokeholds are what inexperienced people try to do to try to cut off breathing. In competition that we do in wrestling, jiu-jitsu, judo, Greco-Roman, and so forth, what you're really doing is what we call carotid compression. And applied properly, the damage to the carotid is really pretty minor. And again, we just don't see that very often. But among police departments, among folks who do not have experience, people who don't know what they're doing, yes, you do get some serious problems.
to bring that up, I had a niece who ended up going to a chiropractor and getting their neck adjusted. Turned out that she genetically only had one vertebral artery. And when it got adjusted, it got occluded. And she had a major problem from that. So my advice to her was be careful of these chiropractors who do that kind of adjustment. And a lot of people do that wrestling, they don't know what they're doing anyway. So it may not be a chokehold, but they apply the carotid pressure wrong. In an article I recently read, that there's also increased stroke that happen from carotid artery. I didn't want to include the slides on that, but it's definitely a factor that is increasing, especially in young people. Let's go to the
Yeah,
next.
let me just mention one other thing that's also kept people from getting treated is that the stimulus that's used to treat attention deficit disorder, um, while there's the potential risk, is that there's really surprisingly few cases of them leading to stroke and so forth, probably because they're given under medical supervision. On the other hand, when the stimulants are used in the street, recreational, that's when the problem occurs.
What kind of drug do that, Dr. Lawson?
Which ones? The methamphetamine, the also Ritalin and the other related agents.
Okay. Dr. Walsh, I think you're next, right?
So I am. So this slide is about emergency action when you think that someone is at risk or having a stroke. So be fast, meaning recognize a stroke in seconds. The B in be fast is for balance. So you're looking for sudden dizziness or loss of coordination. E is for the eyes, sudden vision loss or change in vision. And then the F from fast is the face. If one side of the face droops. A is for arm, one-sided weakness or numbness in an arm. Speech, if the speech becomes slurred, confused, or there's an absence of speech. And then then T, time. Call 911 immediately. Also, you'd be looking for and reacting with this same calling right away for a sudden severe headache, confusion, or trouble walking. Be fast.
Excellent. Any other thoughts on this side?
I have another thought. The thought is that, well, why am I trying to be fast? And the reason I'm trying to be fast is because when parts of your body aren't getting blood to it, aren't being perfused, those parts of your body die. And so what could be something that could be reversed quickly, if it is left without treatment, without some intervention, you may not get that function back, or you may not survive the incident. So this is a very important slide because it is telling you to react in a hurry. And the reason you react in a hurry is you can save function or you can save a life.
Let me give you a situation, Dr. Walks. You're an older Black lady who may be in a wheelchair and you're having a stroke. And it's a Saturday night and 911 is busy with all the violent crime that may be happening around you. What are your choices? How do we survive in that type of situation? And you can't drive.
I'm going to let Dr. Hines, my family practice doctor, answer the question, because I know back in the days there were things. You say, well, you know, you got to get an aspirin or bite an aspirin, or there were home remedies that you could do in the meantime. But I am not up on that. And the worst thing you can do is take advice from somebody who doesn't know the good advice.
Dr. Hines?
So to that point, right? So if there is, depending on what's available to you from a resource perspective, because 911 timing is a real thing for lots of people.
Yep.
So if there is somebody who lives with you or whoever is your care person who you can alert that something's going on and have them drive you, that can be helpful too. But if 911 is not an option and you are able to speak, right, then you want to see if somebody else can get you to a hospital. There are not, because strokes can be bleeding issues or non-bleeding issues, there isn't the same take an aspirin like there is for heart attacks. It's really get to a hospital as soon as you can. Part of the other reason for the timing is because there is a window where if you have a clotting stroke, you can potentially use clot buster medicines, but there's only a certain window of time where that can be done, and there's usually only certain facilities that do that. So timing is, really important. The other thing too is if you can note when you first started having those symptoms, because that way your team will be able, when you do get to the hospital, they may be able to decide what treatments are available to you if you're able to say it started 2 hours ago or it started 20 minutes ago. And then they'll be able to do the math to figure out what you might be eligible for or not eligible for. You bring up a really good point about being in vulnerable situations, right? So that's also those times where pre-planning ideally would be helpful. So if we get the little life alert things or any type of emergency call buttons or things like that, if you are able to. Sometimes the situation is you're in the chair or you've fallen out the chair and you can't get to any of the resources because of the way the stroke is manifesting. Unfortunately, there's...
I was going to say it's good to have an automatic call list of relatives or friends that you can press one button and get
absolutely
this little thing right here I wear around my neck.
Yeah.
I'm not saying it's called a fall detector, and it will call 10 different people if I fall out or do something, and the fire will break down my door to get me.
And that's exactly what I mean about prevention and pre-planning, right? Like you've thought of a plan in advance. The other thing I just wanted to add to is there's a couple of things that I've seen across the years with regard to stroke symptoms, especially my leg just wouldn't work. I went to go get out of the bed. I've seen this many times. I went to go get out of bed and my leg just wouldn't work. So then I laid back down and then,
that's right.
You'd be surprised, right? Like, I don't know what's going on. If I rest a little longer, then maybe that'll fix the problem. No, right? That's not what you want to do when you wake up, right? Because waking up is a common scenario. I woke up this way. It is not lay back down. It's not, well, I'm gonna just sit here for a while and see if it works out. Those are all the things that you don't want to do. The other thing I just want to say is, I think pretty people are very in tune to the kind of physical symptoms, but some of these things in the slurred speech, confused speech, people saying things that don't make sense all of a sudden, or you're trying to say stuff and the words that are coming out are not the words that you're trying to say, those are also signs of a stroke and need the same attention that the physical signs need too.
And
And I
also,
just also want to note that it's a big problem for young people who are having a stroke as a result of drug abuse. I've seen many cases in which folks who use cocaine, high, people around them actually see that the person has slurred speech, say, "Oh, my arm's going to sleep," and don't seek medical attention because of the fear of the forensic or criminal kinds of issues that may arise. So telling friends usually don't do anything because they want to protect the person from possible arrest or worse. So again, especially need to get the word out to those folks who may be using recreational cocaine or recreational stimulants, and that strokes can occur in young people. I had a teenager who had a stroke and had long-term consequence because no one even thought of getting any kind of medical treatment.
I'm going to bring up two issues. One, I tell people who come to see me in the office, don't drink coffee before you come see me because automatically make your pressure go high. But even more important, there's something called advanced directives that ought to be a part of everybody's business. This means that if you are unable to talk, unable to direct your own care, unable to tell your physicians what your wishes are, it's important to create a document called advanced directives. And who is your beneficiary? Who's going to be the person in your family or friendship circle that can make decisions for you should you be disabled? And you can revoke that or change it at any time. But it's something we may talk about in another session, something called advanced directives. Very important. Next, Dr. Hines, is it Dr. Hines?
So what to do and what not to do. So call 911 and use the EMS. You do want to note the last known well time. And you do want to keep the person safe and still if you can. And you do want to bring a medication list if that is available. You do not want to drive yourself because, again, you don't know what's developing. You could lose consciousness while you're driving. So you do not want to drive yourself. You do not want to wait for the symptoms to pass, like we were just talking about. Laying back down is not the answer. You do not want to give food or drink. These are all very empathic things that people want to do to help, but that is not the answer. People can have swallowing difficulties when they're having strokes. You do not want to give aspirin until bleeding is excluded, as I said before. For a heart attack, yes, right? But for a stroke, you don't want to give aspirin because you don't know what the underlying issue is. And minutes lost equals brain lost, as Dr. Walk said. The time that is spent with your brain not having access to oxygen and the nutrients that are in blood is time that tissue gets damaged and dies.
What's that amount of time usually the brain doesn't get oxygen?
I can look that up for you. I don't really know because strokes are miraculous, right? You see some people who've had devastating strokes and given enough time, it's not so much that the tissue comes back, it is that the brain can rewire and create some alternative pathways. So there have definitely been instances with proper physical therapy and things like that. People can make tremendous recovery. Sometimes that happens over the course of months, but for some people, it happens over the course of years.
Excellent. Excellent. Let's go to the next slide. Dr. Walks.
I think that was Dr. Lawson's, but I'm happy to take it.
Dr. Lawson, I'm sorry.
All right. Whoops. I got a block in terms of, there we go. Fast treatment can restore blood flow. Brain scan, CT, MRI tells the team whether a clot or bleeding caused a stroke. Clot buster. Eligible patients may receive tenecteplase or alteplase, generally within 4.5 A's, there we go. 8 hours from lumpectomy. Selected large clots can be removed by catheter, sometimes up to 24 hours. The sooner treatment begins, the better the chance of recovery.
Did you look that thing up, Dr. Hines? The amount of,
What did you say? I'm sorry.
did you find that look up?
Oh, yep. I'm looking it up still.
So we know that the brain is time sensitive, so even though you may recover, the more quickly you can get oxygen and blood flow going to your brain, the better. And that's one of the things of CPR. You breathe for the person, and you also keep circulation. So the circulation is kept by chest compressions. The breathing is either a mouth to mouth, or better yet, a respirator with a face mask. And it's important to do both things. So we can go to the next slide while she looks that up. She can break in when we go to that.
Yep.
Okay, Dr. Walks?
Okay, bleeding strokes require a different plan. You want to lower dangerously high blood pressure safely. Reverse blood thinners as quickly as appropriate. Control pressure or fluid buildup in the brain. Repair selected aneurysms with coiling or clipping. Use neurosurgery when the location and condition warrant it. And those are all things that a medical professional would be doing, not you at home trying to lower blood pressure safely or do anything about clipping or coiling aneurysms. This is why it's important to get someone through EMS to an appropriate healthcare providing facility as soon as possible. And this is also why aspirin should not be given before brain imaging. So stop trying to figure it all out yourself. Just figure out how to get them to the place where they know what to do.
Excellent.
So to the question about the impact on the brain with varying times without oxygen. So for 0 to 30 seconds, and this is kind of globally, not necessarily specific to strokes, but 0 to 30 seconds is, if we're talking about general lack of oxygen across the board, you're going to lose consciousness. But if it's 30 seconds, you may not have any lasting damage. 1 minute, individual brain cells begin dying. 3 minutes, neurons suffer extensive damage and lasting injury becomes more likely. 4 to 5 minutes is when permanent severe brain damage begins as widespread cell death sets in. And then 10 minutes, severe damage or coma is virtually inevitable. And then in 15 minutes, survival or meaningful recovery becomes extremely rare. Now, that is in the context of overall not having oxygen to the brain. But if you take that same concept, so after 4 to 5 minutes from anything that is downstream from the wherever the clot is in that particular artery, things are dying further and further away. It's almost like when you see those in the movies and someone is shot, right, and the blood is spilling and then the pool gets bigger and bigger and bigger over time. So over time, the area of damage is getting larger and larger as the minutes pass by.
Just want to note that it also depends on which part of the brain is involved. The hippocampus in particular, very sensitive to deprivation of circulation. And so you can very quickly have folks with impaired short-term memory because of even less than 30 minutes. It can recover, but that's because the hippocampus is also able to regenerate itself, whereas many of the other brain structures just can't.
Dr. Lawson, can you also comment on if this stroke happens when you're ice fishing and you drop in the water and it's ice cold, does that prolong your lack of oxygen, having less effect?
Yes, it does, but it depends. There's no the Germans actually did some experiments with that during World War II. Took some of the concentration victims to see how long they can stay under without and still recover, and found that sometimes they were able to go for not only several hours, but even maybe a day or so. But the problem is they also did not just brain damage, but they had damage in other parts of the body as well. So
So
that
that would work
it's
in Florida,
unpractical.
in Tennessee, though. Okay, let's go take the next slide if you would. Should this be you, Dr.
Yep. Most stroke prevention starts with 8 habits. 1, checking your blood pressure. 2, taking your medicines consistently. 3, controlling your diabetes if you have it. 4, lowering your harmful LDL or your bad cholesterol. 5, stop smoking and using stimulants that are non-prescribed. 6, move, exercise most days. 7, reduce your salt intake and eat more plants. And 8, treat sleep apnea. And if you have any atrial fibrillation or irregular heartbeats, treat that as well. Ask, what is my blood pressure target and my personal stroke risk when you see your primary care provider?
Or whatever provider you have.
I just want to quickly note that caffeine is a stimulant.
That's true. That's true. I know a lot of my kids drink this Red Bull and stuff. That's a stimulant. Not only cocaine, but a lot of energy drinks. There's a red one and a black one. I don't know what they call them.
Yeah,
Those are,
there's a bunch of different energy drinks, but they
Oh,
don't
yeah.
have cocaine in them. They have just so we're clear.
all right. Take the next slide if you would, Dr. Lawson.
A community plan that can save lives. Know your blood pressure. Share. Be fast with family. Act. Call 911 immediately. And I might also add some strokes do. So present with psychiatric symptoms, call 988 if the person has no evidence of direct physical problem. Then follow up after a TIA or stroke. Stroke is preventable. Stroke is treatable. Time matters. Be fast. Call 911. And I just want to throw in the thing that post-stroke depression is extremely common, but responds to the same kind of treatment as regular quotes depression. Extremely common, can be dangerous.
Okay, next slide.
Want me to go again? No.
No, I think we're finished.
I think your point about Dr. Lawson, your point about post-stroke depression is really was a really good one because it doesn't get discussed enough, right? And lots of times, I mean, you got plenty of reasons to be depressed sometimes, right? You've for some people you've lost a lot, right? I definitely think that is something that I don't see addressed or asked about as often as it should be.
Just to know, one of the complications of major depression is suicide. And again, just like you showed the slide, the twice risk for stroke, the risk of African American men committing suicide is more than any other ethnic group except Native Americans.
And tell me about how does stress contribute to that risk of stroke? Dr. Lawson, Dr. Walks?
No, I'm sorry, I didn't hear that. Try to what?
Is there a contribution of chronic stress?
Oh, that's an excellent question. A colleague of mine at the University of Michigan did a series of studies about this, found that Black folks reacted differently to stress than white folks. Whereas white folks go out and try to get some sort of treatment or relaxing, we disproportionately develop self-destructive habits. And that include going get high, using drugs, smoking, drinking alcohol. So one of the issues is when folks are exposed to stress is what to do about it. And one of the things that is not good is doing all the things we just talked about that can increase the risk of stroke and other kinds of medical and chronic complications. The other part of it also is that we're now recognizing that taking a break, relaxing, often can be very beneficial. You don't have to remove the entire stressful environment, but you can take breaks from that stressful environment, and that can prevent some of the complications. And then the other thing is, I mean, I can go into a whole lecture about this, but the John Henryism, that we have to double prove that we're better than everyone else, that the way to deal with stress and concern is to work more than everybody else, and it's often self-destructive. Instead, that there is a lot of benefits to taking a break, to taking a vacation, to relaxing. There are unfortunately a lot of complications. You may make a little bit more money, but dealing with stress by overworking, trying to do too many different things, trying to take on the world on your shoulders, simply often not beneficial in the long run.
I have a question specifically for Dr. Walks.
So Dr. Maxey, before you ask your question, Dr. Lisa Kervin-Dawes from Jamaica has had her hand up for a long time.
Yeah.
Okay, Dr. Lisa Kervin-Dawes, how are you? Please talk.
I'm okay. Yes, I actually wanted to include this from the beginning. So, Jamaica is about 76, 77% Black people. But it's one of the few places in the world where dying from a stroke, it's much higher than dying from a heart attack. So I looked up some of the statistics before because I gave a talk recently. 13.6% of the deaths in Jamaica are from strokes. That's from all causes. So that's very high. And we are getting them younger and younger. We see a lot more in pregnancies with the preeclampsia, eclampsia, but even when they're not in eclampsia or preeclampsia, they're coming in with strokes. And we're actually looking into that. We do have the phenomenon as time becomes more stressful, in the young people, they're going out with alcohol and energy drinks.
Yep.
And we have been trying to talk because we're getting a lot of strokes from that in the younger people. In our population, we have more males than females having strokes. Not sure for the US population. Interesting study came out in Jamaica saying that if you had a tertiary education, you increased your stroke rate by 5%. So you have a higher risk of getting a stroke the more educated you get, which I found interesting because it stuck with us. But we are seeing now a lot of strokes. And I actually get to quote the statistics because I'm head of medicine. So we see the statistics every month.
So if Dr. Walks pays my ticket to Jamaica, I'll be less likely to have a stroke, right?
No, you'd be more likely to have a stroke. I'm getting a stroke just because you're not listening to Dr. Lisa. All you want to do is go to Jamaica.
But here's my question specifically for Dr. Walks. A lot of us are Christians, and we go to church every Sunday. And many people believe that their Christian belief can solve all of their problems of stress and mental health. And they think that God will take care of everything. What's your answer to people who believe they don't have to do anything but just pray, Dr. Walks?
Dr. Maxey, being a Christian is a wonderful thing. Being a Christian, being Muslim, being Jewish, all of it is wonderful, but none of it, I haven't found any Buddhist, Hindu, none of it involves you just praying and doing nothing. None of it. So, as a matter of fact, faith without works will get you nowhere. So all of the things that we talk about on Black Health Trust, in all seriousness, all of the things that we talk about on Black Health Trust fit very nicely with your Christianity, with your Hinduism, with your whatever it is that you believe, because I have not ever found one religion that believes all you do is pray and do nothing.
That's right.
Okay, we're at the top of the hour. Do we have any other
Yeah.
comments in the chat?
No, one quick comment from Jamaica. So there is a saying in Jamaica, and it is probably true because when that most of the gunmen actually will wear a cross and go to church on weekends. And they say once you've asked for forgiveness, you're forgiven. And it allows them to rest better.
Well,
A matter of faith. So whatever you did, if you ask God for forgiveness, he forgives you.
I think that's like some of these people who are, what do you call those white Christians? That's BS.
So let me say this, Dr. Lisa, as someone who has had a family member shot by one of the gunmen in Jamaica, and know a lot of people that have been shot by gunmen in America. Let me say this about that. Yes, there's a strong Christian support for the notion that all of your past, present, and future sins are forgiven once you become a Christian. That is true. And at the same time, God knows when you're playing. God knows when you're playing. So if you want to go ahead and pretend that you are a Christian or you're a Muslim or you are a whatever it is that you are, and you are following those beliefs, but then you are acting all out of sorts, I'm gonna let you take that up when you get to the pearly gates. When you when you get there, I'm not the one judging, but I believe that God knows when you're playing.
Amen. With that being said, and no other comments in the chat, let's go for final comments. Make them brief. We're at the top of the hour. Let's start off with Dr. Lawson.
Yeah, I just want to follow through what Dr. Walks has said, and I think the message that's coming through. Lifestyle can make a difference. And what we find is that if you look at different religious groups, basically we find, as Dr. Walks said, doesn't matter what religion you are, most of them promote a lifestyle that leads to a reduction in rates of depression, stroke, a lot of other health complications. It's not saying that you belong to a specific religion, it's living the lifestyle that's associated with that religion. And it also runs across culturally as well. There's a lot of work showing that people who live in, again, folks who Nigerians, before they developed the American lifestyle, have lower risk rates of say they develop American lifestyle, rates go up. Same factor in South Africa. If you look at South Africans, initially the hypertension rates were low. They got adapted to the Western lifestyle. Then blood pressure rates go up. And then the second thing again, which is often frankly ignored, is the role of substance abuse and mental health. We're involved. A lot of the drugs, the medications, we take a lot of drugs that we have in everyday life, stimulants and others, can impact and cause things like stroke. And we need to be more assertive in terms of reaching out to the people who are manufacturing these and promoting these in our community, that these are risk factors for our community. And then they found, I think the important thing is one of the big complications of stroke still post-stroke depression. Big problem. Even though the person may recover, they may have chronic ongoing depression, sometimes suicidal, and it needs to be addressed. And the way to prevent it, of course, is not to get strokes, but it needs to be addressed as well for the person to have a positive quality of life.
Thank you very much, Dr. Hines.
I would say just three things, right? So if you have the risk factors that we've covered, please put some thought and action into a preventative communication plan, right? So know what to do or have a plan if for some reason you become, incapacitated, right? 2, if you do have a stroke, the Be Fast thing, can't stress that enough. if you're having those symptoms, respond to them quickly and then call 911. And lastly, if you have a stroke, especially some of the more profound symptom kind, where you start is not necessarily where you finish. So don't give up. Engage in your treatments and your therapies and those types of things. It may take some time, but recovery is possible.
Thank you so much. Dr. Walks?
Thank you, Dr. Maxey. So I used to have this cousin that I love very much, and she was a wonderful human being. And she got to the ripe old age of 31. Now, she was anxious a lot. And so because of her anxiety, she smoked cigarettes to calm down. Cigarette smoking increases your stroke risk significantly. She smoked a lot, and she had a major stroke at 31 and she died. And I'll never forget that because it took me a long time to understand how young cousin Jennifer at 31 could have a stroke and die. But it ties everything together we've been talking about. It ties all the mental health stuff together that Dr. Lawson has been talking about. If you have any sort of a condition, get it treated. One of the earlier slides we looked at today talked about appropriate intervention. Smoking is not an appropriate intervention for your anxiety. It's just not. And so the opportunity for us to do two things. One is figure out or have someone help you figure out an appropriate way to handle whatever is bothering you is really, really important. And then you are never too young for any of the stuff we talk about. It may be more common as people get older that you have some sort of a health problem, but young people have bad things happen also when you don't protect your health. So all of the stuff we talk about on Black Health Trust is really useful for all ages. This is not just a bunch of old people saying that when you get old, you're going to get sick. No, it's awful. I spent time this weekend with a young family who were disconnecting their 2-month-old from life support. I was in the hospital room at the neonatal intensive care unit. It was traumatic for everybody, including me. And so we all need to make sure that we are thinking about health and maintaining health and protecting health from the beginning all the way through. That's it.
Thank you so much. Before I give my final comments, Simon, I want you to tell our listeners how they can find our episodes on the Black Health Trust. What social media can they go to pick those up?
You can find us under the same name, Black Health Trust, on Facebook and on YouTube.
Okay. Thank you so much, Simon, for all of your help. And as my final comment, I want to say, take care of yourself, everyone. Know your numbers. Take care of yourself medically. Don't wait to have a stroke unless you just want to see the pearly gates, as Dr. Walk says. Don't just lay down and go to sleep unless you're guaranteed entrance. Everybody wants to go to heaven, but nobody wants to die.
That's right.
Thank you. Thank you very much. Have a great afternoon.
Good day, everyone.